I'm Mark Thomas, and this is Carolina Focus on News Talk 1110 99.3 WBT, 107.9 The Link, 102.5 610 WFNZ. It's where we look at issues, events, and happenings that affect the Carolinas, the Charlotte region, and you. Welcome. So glad you could join us here once again this morning on Carolina Focus. And we get into a lot of different things here if you're a regular listener to the program. And like we say, we pretty much cover a broad spectrum. And this past week, the North Carolina State Legislature reconvened for 2019. And one of the first bills that was proposed to be introduced by Lieutenant Dan Forrest and Senator Vicky Sawyer, who represents part of Iredell County, is a bill to prevent the female genital mutilation. It's a bill that is in reaction to a court decision late last year which struck down a Michigan law which prevented female mutilation, genital mutilation, as it's being called, or female circumcision, if you will. And this has created a response in a number of states, and North Carolina is not going to be left out of all this. And this is an issue that a lot of people cover, a lot of people talk about, that is to say female circumcision and female genital mutilation as it's described. But something that rarely is talked about is male circumcision. And joining us now, because we're going to cover it this morning, is Mr. Anthony Losquadro, and he is the founder of Intaction.org, and he's joining us now here on Carolina Focus. Mr. Losquadro, welcome to Carolina Focus.
Hey, Mark, thanks for having me on the show.
Yeah, and this is something, I guess my first question is, what started your trip down this road? What got you interested in male circumcision as a cause?
Well, there's a number of factors that led me to get involved with this, because I felt like Americans needed this information and they weren't getting it. But I have an unusual job in that I'm telling people about the benefits of having an intact body and what we call the four powers of foreskin, and why foreskin for males is awesome. And, you mentioned the issue of the female genital mutilation, and that was a federal law that was overturned. And now the states are trying to make up lost ground on that to protect girls. But Americans are going to have to really come to a decision that if we're going to say cutting girls' genitals is wrong, then we're really going to have to look at what we're doing to boys.
And I guess, if people look at this, and I'm sure people are listening to this, and probably half the listeners are cringing right now because they don't want to think about it. But male circumcision's been around for millennia. Going back, if you want to take the biblical stance, going back to Abraham. And now this was something for the Old Testament, but then if you look at the New Testament, it says there are many statements which say this is an unnecessary procedure, you don't need to be doing this. Why has this continued? If it's a Judaic practice, why is it so universal in America, which is supposed to be a Christian nation?
Yeah, that's a good question. Like you said, it goes back thousands of years, but it's really just for certain religious groups that do it. When you look back at Europe, Europeans have never practiced circumcision going back thousands of years, going back prior to the ancient Greeks. So how did America get on this course? It really started in America around 100 years ago, when during the Victorian era, when they were trying to prevent little boys from masturbating. And they thought by removing the foreskin, because it's so sensitive, they would be able to stop that. And you have people like Dr. Kellogg, who was a big advocate. He invented Kellogg's cornflakes, so everybody should be familiar with that. And there were doctors back at that time that thought this was a real issue and they had to stop it, and they convinced parents to do it. And after that, it became a business. And in America, we're a fee-for-service medical system where the more doctors do, the more they get paid. And they've been pushing this issue because it's income for them. And when you look at Europe or other countries where they have a national health service, even Canada, where they don't pay for it, and circumcision rates are minimal to nil.
And we're talking with Anthony Losquadro here on Carolina Focus about male circumcision and why it's done, and why he thinks it needs to be something that I guess pretty much should universally be stopped. Obviously, this is something that most of the men listening have probably had it done because most of them are American men. but it's not something that you actually remember. But you seem to indicate in some of your research that it does have some psychological effects long term.
Yeah, you're absolutely right, Mark. There is emotional and psychological harm to babies, and a lot of that stems from the pain that's inflicted during the procedure. You have to realize doctors can't use anesthesia on a baby like they would on an adult. They use little to no anesthesia, so the baby's subjected to this process, which takes almost as long as 15 minutes, in which they have to crush the foreskin in order to prevent bleeding. So just because a child doesn't remember something, that doesn't mean it doesn't affect them. And pain and trauma done to babies has been associated with changes in the brain, in particular in the region of the brain which is called the hippocampus. It controls memory and emotions and other functions crucial for development. So these things do affect babies, and I think they do affect adults later on. And there are other studies I can mention that talk about some of the issues men have that can stem from this early childhood trauma.
And keeping in mind we are a family program, go ahead and tell us a little bit about some of that research, if you would.
Yeah, no, that's perfectly fine. For instance, there was a study published in the Journal of Men's Health recently that found that males exposed to circumcision trauma had higher rates of personality trait disorders, where they had difficulty identifying and expressing their feelings. The technical term for that is alexithymia. You don't have to know that, but it just shows that some of these problems later on in life do stem from this early childhood trauma. I had another instance. I had, a lot of people call us because I've been doing this for over 10 years, and I speak to nurses, I speak to doctors, and they tell me things kind of on the side. I had a technician just speak to me just the other day, and her job was to do brainwave studies of babies that were exhibiting issues. And would some doctors become concerned during circumcision because the infants exhibit signs of seizure, and those symptoms might be like eyes rolling back, excessive shaking, erratic breathing, to the point where the doctors get concerned that they have to do a neurodiagnostic study on the baby to find out what's going on, and it's really just from the circumcision. So we're putting babies through so much stress and trauma that's so unnecessary, because there are over 22 medical associations around the world that specifically say do not circumcise baby boys. It's not necessary, it's painful and traumatic, and the foreskin is important anatomical functions that nature put on our body for a very good reason. Well,
a couple of things I know. A lot of times, I hear this when I've had conversations about this in the past. Well, it's medically necessary because you can get cancer of the foreskin, and we want to eliminate that. Or there are other health or hygiene problems that can arise by not being circumcised. Is this just kind of an excuse, or how would you categorize that sort of defense of the practice?
It's a combination of ignorance or scare tactics by doctors. The American Academy of Pediatrics, which is kind of like the leading American medical association that does policy statements on the issue of circumcision, they said you'd have to do 322,000 circumcisions to possibly prevent one penile cancer. And in the process of doing those 322,000 circumcisions, you'd have 664 complications or botches.
Well, and you talk about that number of, the hundreds of people that or baby boys that would be impacted by this. On an anecdotal level, I know a family who went through it was a life-threatening situation as a result of having their son circumcised. He was in the hospital for months trying to recover. Now, I don't know what sort of medical bills. This isn't something that they necessarily advertise or talk about, but I imagine it was probably financially devastating as well as psychologically and emotionally to have your infant child being hospitalized in intensive care due to what you consider to be an unnecessary procedure.
Absolutely. That's kind of like what the crime is the whole thing's unnecessary, and you put a baby through all of this. There's a number of cases that have hit the press because they went to court. There was a case of Stacy Willis in Georgia where her son was seriously disfigured. The doctors amputated part of the penis during circumcision. You have to realize they put this big clamp device on the tiny baby because they need to do that to stop bleeding. They amputated part of it, They wrapped the baby up, told the mother, take the baby home, don't worry about it. And she got home, the baby started bleeding. They went to the emergency room, and it was like the doctors tried to cover it up. And she was awarded over $30 million in damages. There's a case in New York where a doctor botched 2 babies in a row, seriously disfigured them, and now those hospital and the doctors are facing lawsuits. So we find out about it when the cases hit the court system. But there are, a study done in Utah found over 11% complication rate from circumcisions, and many of them just get swept under the carpet. Nobody wants to talk about it. The hospital doesn't want to talk about it. The parents don't want to talk about it, and it's unbelievable.
And we're talking with Anthony Losquadro here on Carolina Focus about the organization he founded. Intaction.org is the website, and his efforts to end the practice of male circumcision. Are there any times when it is something that should actually be done? Does there become a case of medical necessity for this procedure?
Well, I like to answer that type of question with yes, there absolutely is. You know what it is? When the person is of 18 years of age or older, and they decide as an adult this is what they want. That's the best time to do it. And like any cosmetic surgery, if you want a nose job, or if you want a tattoo or a body piercing, you do it as an adult, and that way, if you're unhappy with it, you only have yourself to blame. But we can't do it to babies. Something that's totally unnecessary. It's very risky and painful, and they can't consent to it.
Well, you bring that up, and it reminds me of another friend of mine whose father wanted to get into the Navy, and apparently back in the late 40s, early 50s, they wouldn't take him because he hadn't been circumcised. So he went out and got circumcised, went back for his physical, and failed for another reason, which, it's like, don't. What am I doing? But let me ask you this, because I've been told this as well. We want to do this because, Dad's that way, and we don't want them to be embarrassed in the locker room, and it's purely a cosmetic type of a procedure. What is that? Is there any justification for that psychologically?
When I hear those things, those are all what I call low-level arguments. And people generate low-level arguments because they don't want to face the real issues. And they don't want to discuss that, as a man, maybe this was done to me and maybe it shouldn't have been, or maybe I was wronged. For parents, maybe they don't want to go back and say, well, the decision they made for their sons was wrong. So people use this to try to not have the real discussion on why we're doing this or why we're not doing it. The circumcision rates in America are around 56% right now. So it's practically like 50-50 almost. So if you go into a locker room, half the guys are going to be cut and half the guys are not going to be. And anyhow, I was in the military. I've been in a lot of locker rooms and barracks. Nobody's looking at each other's penises, and certainly no one's commenting on it. That's a whole
different discussion for another topic on another day. As far as that goes, what sort of traction are you getting? Are any state legislatures, or are you making any progress in this effort? And we've only got about a minute or so.
We don't go we're not going after the legislative route, because we finally give people this information. For the most part, they get on board with it. It makes sense. It's just like they need that little bit extra to say, yeah, cutting off part of a baby's body is crazy. Why are we doing it? They just need that little bit of information and a little bit of a push, and they come over to our side. So we do a lot of public events all over the place with our mobile units and our exhibits. We give people literature, and they come up to us and they thank us for being out there. They say, I never heard of this before, but you're so right.
Anthony Losquadro with Intaction.org, INTACTION.org. We appreciate you being here on Carolina Focus, and good luck in your efforts.
Thanks for having me on the show. It's been awesome.